We know that no one knows your child like you do. Therefore, you may recognize subtle changes in their behavior that concern you about their condition. If you see any changes that cause you to worry that your child is getting worse quickly, or if there is an emergency, you can call 64111, give your room number, and ask for a pediatric rapid response. A specially trained emergency team will come to assess your child and provide treatment if needed. It's much like calling 911 at home. Any family member or staff member who is concerned about a child can call for a pediatric rapid response. While in the hospital, your child is more at risk for falling. This is because they may have an IV that is connected to an IV pole that must go with them when they walk around. They may also receive medications that cause them to be confused or sleepy, or they may be weaker than usual, all of which may increase their risk for falling. So to help keep your child safe, we ask you to do the following. Keep the bed low to the ground at all times. Keep the top 2 side rails raised at all times while your child is in bed, and all crib rails up for a child in a crib. Have your child sleep in a crib if he or she is younger than 2 years old. Keep non-slip socks on your child while they are out of bed. We provide the non-slip socks for your child. Help us keep your room free of clutter. Call for assistance if you need help getting your child out of bed, to the bathroom, or for any other reason. Stay with your child if he or she is riding in a wagon or on a tricycle or another moving toy. Everyone has good germs that live on our bodies, and they help keep us healthy. We all pick up both good and bad germs from touching objects or other people. Many infections and viruses, like the common cold, are spread by touch between contaminated things or people. Since germs are invisible, we will not even know that we may be spreading bad germs around. All staff, family, and visitors must wash their hands before entering your child's room and upon leaving their room. This helps prevent bad germs from being brought into your child's room and decreases the risk of cross-contamination between patients. There are 2 equally effective ways to remove germs from your hands. Washing for 15 seconds with soap and water removes bacteria with friction. Alcohol foam or gel rub kills germs directly. Remember that children may need help with hand washing. Children sometimes have infections that require staff and/or families to wear hospital-provided personal protective equipment such as gowns, gloves, or masks. This means that your child has a type of infection that is easily transmitted to other children through either direct contact with objects like door handles or even through the air we breathe. Every child admitted on this unit must wear a security band. The band immediately triggers the security alarm if a child leaves the unit or is taken from the unit without being appropriately signed out at the front nurse's station. Attempting to remove the band also triggers the security alarm. These bands are to be removed only by a staff member. Security bands are water resistant, so they can be worn during baths or showers. Patients can leave the unit with a family member or staff after obtaining permission from their nurse. Before leaving the unit, the parent or caregiver must obtain a green pass, and the child must be signed out at the front nurse's station. Patients are only allowed to be off the unit for 1 hour, and therefore must return to the unit within 1 hour to check in. Only a patient accompanied by a staff member may be off the unit longer than 1 hour. Patients are not allowed to leave the hospital grounds until discharged.